Let's start with the patients. The benefits for the patients are significant. Over the course of the year, they see a significant cost savings in their out-of-pocket expenses. So that's a huge benefit to them. It's something that they can afford as opposed to some of healthcare, which has become so overly priced that folks can't get in. So the cost savings is pretty significant. From a doctor-patient relationship advantage, I see it as we have many more hours to spend with our patient. We're not bogged down with the administrative red tape hassles and regulations of the insurance world. So instead, we're spending those hours with our patient. Every patient that we see at our office gets anywhere from 30 to 60 minutes, and that is almost unheard of in the traditional model.
So basically some benefits for the patients, which is the most important thing, also some benefits for the doctor-patient relationship. Is it easier to practice this way than practicing where you have to deal with insurance companies and are dealing with a lot of paperwork and lots of things that don't have anything to do with being a doctor?
Easier, simpler, much more rewarding. It makes a lot more common sense to focus just on what the patient needs as opposed to all these other influences and regulations that sort of become a barrier between myself and the patient. For example, if they need a certain medication, all I'm doing is making that decision to get them the right medicine. Not, is it covered on their insurance? Can they afford it? Is it a third tier? Is it a second tier? Does the pharmacy have it? None of that. It's just what is best for that patient. So yes, it's much simpler, much more efficient. We get to know our patients at a much different level because we've got time to do that. And so then once you have an understanding of who that patient is, what problems they're facing, it's much easier to manage their medical problems around that specific circumstance.